Welcome to Dental Notes and Mnemonics. In today's video, we'll explore a fundamental aspect of oral pathology, understanding the significance of color in oral lesions. The color of a lesion in the mouth can provide vital clues to its diagnosis, indicating whether the lesion is benign, inflammatory, or even malignant. So, without any delay, let's get started with the video. The color of normal oral mucosa is typically pink due to its vascularity and thickness of epithelial layer. Coral pink is healthy hue that suggests good circulation and healthy tissues. There is a long list of the factors which may affect the oral mucosa color. Blood flow and the vascularity causes the mucosa to appear red and darker, and this often occurs in response of inflammation, infection, trauma, as blood vessels dilate to increase the circulation to the affected area. Keratinization also affects the color of normal mucosa. The degree of keratinization affects its appearance. When epithelial layer thickens due to increased keratin production, it often results in white appearance. Reduced keratinization can cause the mucosa to appear smooth and pink. Also, the pigmentation affects the color, as the color of mucosa is influenced by the amount of the melanin and other pigments present in the mucosa. Apart from these factors, the other factors which may affect the color of oral mucosa is infections, diet, as certain foods, particularly those rich in carotenoids, can cause yellowish discoloration in the mucosa. Medications, age. As the age advances, the color of the oral mucosa may change due to various factors like reduced blood flow, thinning of the tissues, and decrease in the melanin production. Apart from this, the smoking, tobacco use, systemic conditions like anemia, jaundice, and hormonal fluctuation, especially during the pregnancy, can affect the color of the gums. Trauma, hydration, and nutrition, as well as the temperature, affect the color of mucosa. We'll discuss about different color lesions one by one, starting with the red lesions. Red lesions are caused by the condition that increase the blood flow or expose the vascular bed. Examples include the inflammation as it occurs in the gingivitis, vascular lesions like hemangioma, and epithelial thinning which takes place in erythroplakia. Color lesion is a topic in itself, so we'll be discussing in detail in coming videos for sure. To white lesions arises from keratin overproduction as it occurs in the Leukoplakia, fungal infections in case of Candidiasis, or epithelial thickening due to immune response as it occurs in lichen planus. These lesions range from the benign condition to those with potentially malignant transformation. Common cause of white lesions include the Leukoplakia. It is a clinical term for white patches that cannot be wiped off. This condition may be benign but has a potential for malignant transformation, especially if it is associated with the risk factors like smoking or alcohol use. Second white lesion is lichen planus, a chronic inflammatory condition that can present with white lace-like pattern on the buccal mucosa, gums, or tongue. This is an autoimmune disease and it is typically asymptomatic, but it can cause discomfort sometimes. Third white lesion is Candidiasis, which is a fungal infection caused by Candida albicans. It is presenting as white, creamy patches that can be wiped off, revealing a red underlying area. It is common in immunocompromised patients such as those with HIV or diabetes. Yellow color lesions may be due to the deposit of lipids as it occurs in Fodai spots, fatty growth in lipomas, or healing tissues like healing ulcer with a fibrin cord. Fodai spots are harmless yellow papules commonly found in the oral mucosa. Lipomas are benign fatty growth that appears yellowish, and oral ulcers may have yellowish fibrin coating over a red base indicating a healing or phase of acute inflammation. Blue and purple lesions often result from vascular abnormalities like varices, mucus accumulation which occurs in mucocele, or malignancies like Kaposi sarcoma. The blue color typically reflects deoxygenated blood, while mucus or fluid retention can distort the light reflection. In Kaposi sarcoma, angiogenesis and extravasated blood contribute to the hue. Black and brown lesions arise from pigment deposition either naturally, as in case of melanomas, or smoker melanosis due to increased amount of melanin production, and due to external particles like amalgam, tattoos, and these all lead the darker appearance of the mucosa. Melanoma is the most concerning and often appearing as irregularly pigmented lesion with rapid growth. Smoker's melanosis present as a diffuse brown discoloration, often resolving with the smoking cessation. And in amalgam tattoo, it is caused by metallic particles from the dental filling appear as localized dark spot in the oral mucosa. Green lesions are rare in oral cavity, but their notable causes include the fungal infection, as in the case of aspergillosis, or bacterial infection near abscesses producing greenish byproducts. Aspergillosis is a fungal infection that may cause the greenish discoloration in the oral cavity, particularly in the patients with compromised immune systems. Greenish lesions around the abscesses may also suggest bacterial infection requiring antibiotics. Green lesions, orange lesions are also quite rare in the oral cavity. The causes may be excessive intake of carotenoid-rich foods like carrots, oranges, or other yellow-orange fruits or vegetables. Carotenoids are fat-soluble pigments absorbed into the bloodstream after dietary consumption. When the levels are high, some of the pigments may deposit in the tissue, including the oral mucosa, leading to an orange tint. Certain bacteria, which are known as the chromogenic bacteria, can produce pigments that can stain the teeth and the oral mucosa. These lesions are benign and require no treatment other than the dietary advice if necessary. Those caused by the bacterial pigments can resolve with the improved oral hygiene and professional dental cleaning. Every oral lesion tells a story. Diagnosing it is the key way to uncovering the narrative. Please go through the charts I have provided here, and this will provide you a clear diagnostic clues about the various lesions of different colors. Thank you for watching. If you found this video helpful, don't forget to like, share and subscribe to stay updated with more content like this. For questions or suggestions, feel free to leave comment below. Let's continue learning together. So see you in the next video. Till then, bye bye, take care, have a nice day.